The number of people developing Lyme disease, a debilitating illness caused by bites from infected ticks, is increasing. In 2013, there were 1,400 cases reported to public health agencies in the UK, and experts are concerned that even more cases go unreported because the tests to diagnose it are unreliable. Melanie Abbott has been to meet patients and medics.
I'm just setting myself up in my little studio, and this can sit over my lap and has got a sort of easel top which I can...
Her love of art has kept Rachel Alban going during the last 4 years of her illness. She was 20 and an undergraduate at Oxford when she first began to feel unwell.
The first wave of illness seemed basically just like an unseasonal flu, and it was only maybe 6 months after that that other symptoms started to appear. I wouldn't be able to think clearly, my memory would start to go. I had crippling fatigue, gut symptoms started to occur, tingling and twitches in my muscles. And in the final phase of the illness, I found it very difficult to walk at all.
Doctors thought she might have ME or chronic fatigue syndrome. In fact, some experts believe 9 out of 10 people diagnosed with chronic fatigue may actually have Lyme disease. If it's spotted early enough, it can be treated effectively with antibiotics, but untreated, the symptoms become more severe. Not all ticks carry Lyme disease. There have been no studies to find out how many do. If you get a rash after a tick bite, you may have been infected by Lyme disease, but some people infected never see a rash. It was only when Rachel's mother Louise happened to read about Lyme disease they realised that could be the cause of Rachel's illness.
I was browsing the BBC News website. There was an article about Lyme disease. Turned to her, she happened to be in the room with me, and said, you know, I'd really think it was Lyme disease if it weren't for the fact that you've never had a tick bite.
I said, well, Actually, I have, and I've been bitten. I'd seen a sort of small black insect in my chest, and I'd quickly brushed it away. And a few days later, this sort of 8-centimetre diameter circular rash had appeared. I didn't think it was anything important because I thought, if it's dangerous, I'll know about it.
And so we started piecing that together and realised that actually this all did fit into place, and it really could be Lyme disease.
Even then, it was hard to get a diagnosis. Both of the tests regularly used by the NHS were negative. So Rachel paid privately for 3 more tests and eventually was told she did have Lyme disease.
You know what you're fighting, and that's really helpful. There are treatments available for Lyme disease. It's much harder to treat after a long infection like I had. So you know what you're fighting, you know how to tackle it. And so to have a diagnosis was a huge relief in that respect.
Rachel started a 4-month course of antibiotics, paying privately to be treated by a doctor in Germany. She's already feeling better.
It's nice to be able to go out. There we go. Just going for a short walk outside. A beautiful sunny day.
6 months ago, she wouldn't have had the energy to even head for her local corner shop.
Oh, chilly though.
A conference in London this week called for better tests. Dr. Chris Newton is a research scientist who has been studying Lyme disease. He says the 2 commonly used tests often give false negatives.
They're looking at antibodies to the bug. Problem is, antibodies often aren't formed. I would have gone for something like a DNA test.
Do we need to put more resources into perfecting DNA testing?
I think we do. The Lyme bug can disappear off into tissues, and once that's happened, it's extremely hard then to treat it.
The conference was stormy at times, with many there saying Public Health England isn't doing enough, and their voices were eager to be heard.
These people are ill.
Dr. Tim Brooks from Public Health England later told me they are trying to develop better tests.
We are very keen to look at the best testing methodologies. If they add anything to the tests that we already have, we will introduce them. We also intend to try and develop better tests of our own.
How long will all of this take, though?
Well, any research project of this magnitude, in order to get decent answers, takes several years.
I suppose that's the problem for people who say that they are being misdiagnosed now, isn't it?
Part of the problem is to make sure that those people are actually diagnosed properly with what they have got. So there's still a lot we can do in working with them to look at the origin of their symptoms, and that they have got a proper treatment pathway where such a pathway can be defined.
Rachel Alban says improvements can't come soon enough.
Science really should be embracing this challenge. This disease is really complex, but we do have some of the skills and the scientific tools to treat it. It seems so irresponsible to me not to really push in these areas where science could transform people's lives.
And good luck to Rachel Alban, ending that report by Melanie Abbott.